Hi, I'm Dr. Peters with Peters Wellness Chiropractic in Goodyear, Arizona. This week's quick video is going to be discussing the foam roller. If you've never used a foam roller, I would highly recommend it. Now, some people would say, well, how do I know if I'm in a good enough shape to use a foam roller? Well, today I'm just going to show you one quick move, and I want to put together a series that I'm going to put out to you on YouTube and on Facebook. But for starters, let's just talk about what the heck is a foam roller. So I have the ones I carry here in my office. Now, personally, the ones I carry here are fairly soft. If you push on it, it will compress. I like the ones I use at Lifetime Fitness where they are, well, really firm and hard. And when you push on them, they don't really compress at all. But most people coming into my office tend to be in a lot of pain in the beginning. So we like to start them off with something a little softer. But the reality is, too, in time, these tend to compress and get a little harder as you roll. So in looking at that, the ones that I have are 6-inch in diameter across the center. And I like the 3-footers. I used to sell the shorter ones, but some people with balance issues had trouble literally staying on them, which seems surprising, but as a reality, it was an issue for people. So again, you can order these on Amazon. You can pick them up at Walmart. You can get them anywhere. They're not hard to find because they are so powerful and they work so well. So again, I want to keep this quick, but I'm just going to show you one easy one that I like to do. And then again, I'd like to put together a series and kind of depending on the response I get from this. So I'm sitting on the floor here in the office. And so here we have the foam roller. I'm just going to set it down here. And what I'd like people to do, for starters, is, again, low back pain is a biggie. So I'm just going to put it kind of in the center of my back so you can see. And I'm just going to lay down over it. And you can see I kind of rock like a teeter-totter here. So what I want to do is once I'm on it, I'm just going to let my low back relax. And I want my butt and my head to touch the floor at the same time. So right now, both of them are touching. I'm going to roll, and my butt is touching, or my glutes, if you want to use that wording, and my head is touching. I'm going to roll down, and I'm just going to keep my head and butt on the floor the whole time. And what I like to do is as I roll, I like to use my arms. So first I'm going to start here, and I'm going to roll down and move my arms up, and then come back. And again, keeping my head on the ground and my butt on the ground. So it's just a nice way to loosen up the low back and the upper back. And again, some people might have trouble with that in the beginning. I don't normally get into the foam roller until about a couple weeks into care because I don't want people being too aggressive. But at the same time, I want you to get better as quick as possible. So that's just a real simple one. I'm probably going to put something together for lower extremity. I may even have to break it into like a knee rehab versus a pelvis rehab. Then shoulder. These things are great on the shoulder. You can work the rotator cuff muscles. You can even work your elbows, but you just got to think about it a little bit, and I'd like to put that together for you. So give me some feedback, see what you think of this, and let me know. Maybe you can't see it real good on the video, but we'll put more and more of these together, and I'll just get them out there. Thanks a lot, and have an awesome week.